Hello and welcome to today's episode of the Pediatric Consult. I'm Dr. Jill Schaffeld, your host for today, and I'm very excited to talk to today's guest, Dr. Sanita Ley, a pediatric psychologist with Cincinnati Children's, and Dr. Roohi Kharofa, a pediatrician specializing in weight management here at Cincinnati Children's. And today's discussion is a consult on body image. So let's start by just learning a little bit about our guests, and you guys can decide who goes first on this, but if you could share just a few sentences about your background, maybe how long you've been practicing, and even specifically how long you've been practicing at Cincinnati Children's, any special interests, and maybe include your role with the Center for Better Health and Nutrition here at Cincinnati Children's.
Thank you so much for having us. So I'm Roohi Kharofa. I have been at Cincinnati Children's since my fellowship ended in 2015, at which time I finished my general pediatrics training and a pediatric fellowship in research, which is when I started working at the Center for Better Health and Nutrition. So I've been here 11 years now. I started with spending time both in general pediatrics and at the Center for Weight Management, and then in 2020 I crossed over full-time. And I took over the program as director this past year.
Awesome. Congratulations.
Thank you so much.
They're very lucky to have you. And Dr. Ley, if you could tell us a little bit about yourself and just your role at Cincinnati Children's and specifically with the center.
Yeah, definitely. So I came to Cincinnati Children's for my residency 10 years ago and started my faculty position within the Division of Behavioral Medicine and Pediatrics in 2018. And so since then, I've been lucky enough to support the Center for Better Health and Nutrition, as well as the Type 2 Diabetes Clinic, the Metabolic Dysfunction-Associated Steatotic Liver Disease Clinic, many of the obesity-related comorbidity clinics as part of their multidisciplinary team.
That's wonderful. And I think Cincinnati Children's does a wonderful job with, like you said, having these multidisciplinary teams because, so much of what we're going to talk about today is, the medical care of children, but also, the medical care in supporting their mental health, right? So super important. So I appreciate both of you being here. Our conversation today is about body image and its impact on healthy weight and just overall mental well-being. So just to think about jumping in, what does the term body positivity mean? And I'll ask that question to Dr. Ley. If, I'm saying, what does it mean to be body positive?
Yeah, so body positivity, I would say, is a cultural movement where people focus on kind of loving and accepting bodies of all shapes and sizes and valuing kind of how they look and how they function. Within the literature, we think more about positive body image, which encapsulates a lot of different things. So it includes things like appreciating your body, accepting and loving your body, conceptualizing beauty broadly, so all sorts of shapes and sizes, being invested in caring for your body, so tending to your needs through sleep and hydration, and also acknowledging that beauty can be on the inside and then kind of come out as well. And as people have a positive body image, they do or are able to relate to maybe negative body images a little bit more positively because they're less likely to internalize those images.
Yeah, it's very, very interesting. It makes a lot of sense with, such a big role of, social media and just influences on, I think, our young teens and adults and even younger children, and just how, like you said, body positivity seems more like a cultural movement, whereas body image is defined a little differently. So why would you say this is such an important term for general pediatricians and to understand, and for us to be able to understand this and help our patients? Why is this important that we really kind of get down to the nitty-gritty of this and, support our patients? And why should it start maybe in the general pediatric office?
Yeah, so we know that body image concerns impact everybody. They impact children as young as 6 years old. They impact girls, they impact boys, and they impact people of all genders. We know in school-age kids, body image concerns can present in 40 to 50% of kiddos. And then in adolescent girls, I think it's over 70%. So people of all ages, all shapes, oftentimes patients with obesity tend to have higher rates of body image concerns. And so chances are you will be interacting with a patient that struggles with body image concerns. And it's also not a static trait. And so people's body image changes over time. So whether or not your patient is struggling with it now, chances are they will be at probably some point in their lives.
You know, when you mentioned the 60 to 70% of teen girls, I think, you know, I would have absolutely been like, oh, that's going to be your biggest population. But in my mind, I spun that and thought, wow, so there's maybe only 30% that don't have a concern about body image. And that's seems pretty wild to think about, you know, that small of a group. So what we mentioned a little bit about patient populations most at risk for body image concerns there, but what is the impact of healthy versus unhealthy body image on a youth's physical well-being? And maybe that's a good question for Dr. Kharofa. And then we can delve a little bit more into the mental health and well-being for Dr. Ley.
Absolutely. So it's interesting because so many patients and families think that body image and weight are equivalent to each other. So if my child loses weight or if I lose weight, I will love myself and love my body image. And that can really affect the way they make lifestyle changes to become healthier. And weight is not a representation of health. I tell my kids who come into clinic all the time, you can get on that scale and I bet you can figure out a way to make that number go down. Is that telling you you're healthy? If you skip meals, does that mean you're healthy? Absolutely not. And so I think the first thing we have to do is separate those two concepts, how we feel about our body, or actually three concepts, how we feel about our body, our weight on the scale, and our metabolic health are three different things. And so when we're working on them, we have to treat them individually. Losing weight or being quote unquote skinnier doesn't give you a healthy body image. And I think that's hard for people to understand both at the parent level, at the physician or provider level, and at a community level, because you talk about social media, but you also talk about how weight and metabolic disease is presented in the physician's office. And so I think when we talk about health, while weight is one vital sign, and it's one way to reflect what's going on in our body, really as the medical community, we have to make sure that we let parents and families know that that's just one number, just like the blood pressure is one number, and the triglycerides are one number, and the hemoglobin A1C for diabetes is one number. And all of those things have to be looked at in unison and not individually to judge health overall.
It's super important, and I don't think I've heard anyone ever state it in that way, but I think that's such a neat way to look at it, to say weight and health, or weight and being healthy, two totally different things.
Absolutely.
So that's great. And then Dr. Ley, the impact of kind of being healthy versus unhealthy on mental well-being, you've touched on that a bit, but anything that you had to add to how those two relate to each other?
Yeah, so we know that body dissatisfaction is associated with a lot of mental health concerns like depression or anxiety, social isolation, and interestingly, is also associated with less healthy eating habits and less exercise. And so when I think about making lifestyle changes, I think it's really important to think about, like Dr. Kharofa was saying, focusing on health and not necessarily appearance, because I think sometimes it's hard to separate the two from each other. But when things are appearance focused, it makes us feel like we're not good enough, right? And then that leads to body dissatisfaction versus when we focus on health, which is kind of what your body tends to look like whenever you're maximizing physical health, mental health, quality of life. Every body has skeletal muscle mass. Every body has body fat. That is just how our bodies are made, and how it looks different on every body. And so I think really focusing on health and supporting a healthy body image helps a child to see eating and exercise as a way to feel their body, as a way to move their body in a way that they enjoy, which then changes the experience of being able to engage in those lifestyle behaviors. Versus, I think when things are more appearance focused, it has the potential to really make us feel bad about ourselves, which has some pretty significant mental health consequences, and actually the opposite impact on lifestyle behaviors than maybe we were hoping.
And that's such a hard thing, I think, to think about as well, because, a lot of maybe teens that are struggling with some of those mental health issues, they aren't going to want to move their bodies and be healthy and do those things, and then vice versa, right? Like, the endorphins you get from exercising and from good sleep, and, I think you mentioned hydration before. All of those things, it's like, which thing came first? I kind of look at it as. So, as primary pediatricians, what are some ways that we can support our patients in developing a healthy body image? And maybe we can kind of go from the beginning and talk about younger kids. I think a lot of this, like we said, you immediately think of, the most common issues with body images being in teens, but you had mentioned down to age 6, Dr. Ley. Are there, specific things we can do to help support our patients and support our families and kind of talk to them about how to talk to their children, even at a very young age?
Absolutely. So I think first, as a parent, and we realize this early on, we model for our children all the time, right? By mistake, you say a bad word, you'll probably hear that coming out of your child's mouth, right? And so I think how we talk about ourselves is so important. If your child hears you making negative comments about the shape of your body or how you look or your weight, they internalize that is a way to self-talk, and they will start to use those words, whether it be verbally out loud or in their head. And so I think the first thing is just making sure that parents know that they are modeling for their child. And when you have a baby, like, they just send you home from the hospital
Yes.
with the baby, right? And I remember being like, so I know a little bit more than the average person because I'm a pediatrician, but really you're just like sending me home.
Yeah.
And so I think there are times in the office that we hear parents talk about their own bodies, right? And that could be a time when, if there's an opening, if you have a relationship with that family, right? Or if the child steps out of the room, you could give that little tidbit about, first of all, we need to be kind to ourselves. Second of all, how you talk about yourself is also how your child will talk about themselves. So I think that's kind of my first takeaway. And then the second is, I think so much of body image we are teaching without even realizing it, because we're bringing up the weight as a medical community. And I myself did this as a pediatrician when the weight was elevated, right? But looking at lifestyle behaviors from when your child is first born, right, and talking about juice or how much activity they're getting should be applied to every single child and family. So even it's a well child check, right? Like, thinking about behaviors, it should really be applied to the whole family. And so I think if we took that standpoint from the very beginning in counseling families, right, then we would really never have to be like, okay, well, now the weight or BMI is elevated, so what should we do? Because that family would have heard those same lifestyle changes that they could be working on from the very beginning.
Yeah, I'm thinking as you're talking, we literally take a copy of the growth chart into every visit, even from when I'm seeing infants up to teenagers. And it's sometimes difficult, right? I feel like a lot of my teenagers, they want to know, oh, how much did I grow? Which is height. That's usually a pretty easy one to talk about. But next thing on the list is weight, right? And usually I don't say much about weight. I talk about, activity and how are we being healthy and what are we doing to move our bodies. And and try not to, but it's interesting. It comes up a lot. And then BMI is listed there too. And my spiel always, I kind of go, we're watching trends. We're trying to be healthy here, but it's difficult, right?
It
When those
is,
numbers are right there
absolutely.
in front of the child and the
Absolutely.
parent.
But I think you bring up a great point, the trend, right? If a child was born at the 90th percentile and they've always been there, right? They are tracking. So we
Absolutely.
go through their lifestyle just like we would anyone else. But if they're getting their 5 fruits and vegetables, they're getting their 60 minutes of activity, right? I'm not going to tell that child anything different, right?
Absolutely.
And so using weight as one sign is a vital sign, right? But if that child has acanthosis on the back of their neck, that's one sign that we're getting too many carbohydrates or added sugars in the nutrition, right? And if your child is 9 to 11, the recommendation is that everyone gets screening cholesterol, right? And so you don't just have to bring it up when it's the weight, right? There's so many other times to bring the vitals and the physical exam and the labs together, and to engage the family. And I remember some families were really adverse to talking about weight, but that everyone in the family had diabetes. So the minute I talked about diabetes and the acanthosis, they were completely engaged. And I think part of it is just meeting families where they're at and worrying about what they're worrying about, because the weight in and of itself does not need to be the worry, right?
Absolutely.
It's what is getting us to that weight, and is it unhealthy? Because I always say you gain 10 pounds and it's muscle, that's a healthy thing. I have a special scale in my clinic that tells me that, and primary care providers don't, right?
Right.
But when we start to ask those questions, it's not about the weight, it's about the lifestyle choices that are either improving our health or that potentially need to be balanced more in order to make this the strongest version of ourselves.
So I'm curious if either one of you have any tips for general pediatricians when there are concerns, and maybe it can be either weight loss or weight gain, maybe unexplained, or a surprise where it's not always a checkup. Maybe they're coming in for something else. Maybe, I can think back over the years and, think of maybe some abdominal pain visits. And as you kind of go through the history, you're thinking this doesn't sound like something truly, maybe even organic that's going on. What are maybe some good tips for pediatricians to begin that conversation with patients and families about whether it be unexplained gain or loss of weight?
So one scenario I thought of when you talked about abdominal pain, which is one that I love. So I always talk about there's 200 metabolic diseases, right? 13 types of cancers, knee, back, ankle pain. There's so many things that can be related to excess adiposity specifically, not necessarily excess weight. And constipation is such a common one that every pediatrician is going to see, right? And I love it because it's a time to talk about lifestyle changes where the weight is not involved at all, but the conversation is about how do we get increased fiber? How do we get increased water? How do we decrease carbohydrates, which are impacting your stool quality? All of those things are the exact same guidance I would give to someone in my pediatric weight management and metabolic disease prevention clinic. Gotta say it all because it's not just weight. But the exact same tools, but it's about constipation. It's impacting the family's life. It's impacting the parent's life. It's causing pain.
Sure.
And if we take the time in those situations to counsel around those issues, right, we're affecting the lifestyle for years to come.
Absolutely.
You brought up weight loss though, and that can be scary. That's a whole different circumstance, and we need to figure out, is it a disordered eating or is there something more organic going on? And so I think you kind of come back to the exact same questions. What is the lifestyle, right? And so it's amazing. Lifestyle applies to every single person, right?
True.
And so are we exercising? Are we over-exercising, right? What does our stool look like? Are we having red flags of diarrhea or constipation, right? Are there any signs that there could be a mood issue that we're missing? Bullying, things that could lead to skipping meals or anything to that effect. So I think actually the history is very similar, right? Potentially what we do about who we refer to, right, is going to be different. But I think you're looking at all of the same things you were looking at when there's excess weight gain.
Dr. Ley, any specific language that you can think of for pediatricians to maybe avoid?
I think if we're focusing on the lifestyle behaviors that Dr. Kharofa is talking about, then I think it's less challenging to get into sticky situations because we can't look at somebody and tell like what the underlying behaviors are. Somebody could be gaining weight and losing weight and still be skipping meals, right? And so I think if you're asking about the lifestyle behaviors, you're less likely to get into language issues. We know that broadly talking about good foods versus bad foods, those kind of things are not going to be particularly helpful. And so I think just being very thoughtful about like what is the purpose of this conversation? The purpose of this conversation is to improve their health. And so I think as long as we're kind of aligning with that and using language that aligns, like what are we doing to get energy into our bodies, how are we moving our ways, I think you mentioned this earlier, that we enjoy, I think you'll stay within a territory that hopefully feels good for everybody.
So, Dr. Ley, I was just thinking, are there any factors that you can share with us that you feel like influence body image specifically? Like, what are the maybe biggest things that you see that influence a patient's body image?
Yeah, I mean, I think Dr. Kharofa did a really great job of talking about how family influences body image. It's the water that we swim in. It's the language that we hear around us, and so family plays a huge role. Other factors that play a role are peers, especially as we get older. Kind of what our friends think matters most, and so what they think, or even weight-related teasing, bullying, can definitely impact body image. And the final thing is social media. In media, we are often given these idealized body images that aren't even real. So oftentimes people use filters or intentionally change how a body looks in order to advertise or sell something to us. And so all of those factors really impact how these youth and or even us as adults end up thinking about ourselves. And so as Dr. Kharofa was talking about ideas to manage body image, definitely working with the family. Parents swim, or caregivers swim in the same water that their kids do, right? They were influenced by this diet culture and impacts how they feel about themselves. And so, like Dr. Kharofa was saying, that modeling is so important, making sure that we don't allow any weight-based teasing or bullying, stopping it at school, and also amongst siblings. Like, it's not okay to speak negatively about each other, and then being very careful about the social media that your child is exposed to, encouraging them to follow positive messaging about bodies and unfollowing people that have more negative messaging about their bodies, I think is just really important. And we know that we cannot. Well, I think parents do their best to try to control the social media or the media that their children consume, and media always gets in. So encouraging parents to have these critical conversations with their youth about what they're seeing. So I think when we think about the influences, we can also think about the areas that we can intervene in.
Absolutely. Those were some great points. So when patients do seek treatment for obesity, so specifically, if they are referred by their primary physician to a weight management or obesity treatment program, do you find, Dr. Kharofa, that those patients, the ones who participate in a weight management program actually have a worsening body image? Is it one of, those things where it's like, oh my goodness, I'm getting treatment for my weight, again, weight, not, weight is not health, like we said, but, I could see where maybe one would think, teenagers, gosh, if I refer them, are they going to have a worsening, body image because they feel like there's something wrong with them?
Yeah, that's a great question. And actually one that's been asked in the literature before, because it is a concern, right? If we provide management for metabolic diseases and weight-related diseases, right, are we going to bring this to the forefront and make eating disorders worse? So the data shows that participation in a tertiary care pediatric weight management program, so like multidisciplinary programs with dietitian, exercise, physician, and we're lucky enough to have a psychologist, not all are, actually in the short to medium term does not make your body image worse. Now, that's not to say that patients don't come come in with body image concerns or issues. We actually at our clinic, under the guidance of Dr. Ley, started screening for body image several years ago with every new patient. That's 12 and older. And what we saw was that almost all of the patients rated at least 1 or higher on concerns about their body image. Very few rate 0, males and females, right? And so they have either been bullied or teased or someone's mentioned their weight. And while the screeners, for adolescents and teenagers, when you ask younger kids as well about teasing, almost every child I see in clinic has been teased at some point, down to like 7, 8 years old. It's heartbreaking, truthfully. And so they've already been exposed to this. And sometimes parents say, oh, don't talk about the weight in front of my kid, which I'm totally fine with because I can talk about the lifestyle, which is the important part. But the child has already been exposed to this in the real world. And so what we do at that first appointment, and hopefully every appointment afterwards, is change the conversation, right? So often people come in saying, I was sent here for my weight. And we say, well, you were sent here really to make you the strongest and healthiest version of yourselves. And how can we get there? We show them their muscle. We talk about how to work on physical skills. How can you run longer or faster if that's their goal for being in soccer, right? Or how do we prevent that heart disease that grandma or grandpa had to the best of our ability? And so I think participation actually changes the conversation because we get to de-emphasize weight. And we do that because we have all of these other things that we can utilize. I know that gets a little bit harder for the general pediatrician who doesn't have this special muscle mass scale that I have, right? And I like to speak to that because I was a general pediatrician, right? So it's easy for me to say, well, I'm going to talk about muscle. But I think, again, just if every visit for every well child check, we talk about health and we talk about where we are on the growth chart in terms of are we stabilized, or talk about crossing percentiles. We don't have to identify children as having obesity, right? We just have to identify, right, what are we working on as a family lifestyle-wise? Because the truth is 1 in 3 children now has prediabetes, right? Or by the teenage years, right? And children who have a normal BMI can still have elevated adiposity or percent body fat. They can still be getting more than their 25 grams of added sugar. And so that just clarifies that we're not talking about weight, we're talking about health. And I think that we're trying really hard in tertiary weight management to refocus that conversation. And so far, what we've seen is that we're not making it worse, if anything, providing support. And hopefully the research continues to show that over the decades to come.
And even though pediatricians don't have the fancy machine, they can definitely talk about functioning. Like
Absolutely.
Dr. Kharofa was talking about, we can talk about like getting faster, not getting out of breath, or getting stronger and being able to do more with our bodies. And so I think that still that functional approach can still be taken with patients without having that muscle data specifically. And I'll also say that fundamentally, when we think about the end goal of eating disorder treatment and the treatment that we do, ultimately it's the exact same intervention. We want to be eating consistently. We want to be eating varied foods without forbidden foods, because we all want to have that cake at the birthday party, right?
Sure. Absolutely.
We want to be moving our bodies in ways that we're enjoying, but not too much, because our bodies need breaks too. And we want to make sure that we're not skipping meals and that we're not having an unhealthy relationship with our body. And so in my mind, it doesn't surprise me that meeting with our team supports a healthy body image, because fundamentally, the goals of the treatment are the same. Let's nourish our body, let's move our body, and let's have a healthy relationship with our body. And we're all just trying to get there in different ways, but ultimately the goal is the same.
Yeah, that was great. Those were some really wonderful, from both of you, concrete examples of ways to talk about things. And listening to Dr. Kharofa, when you said parents don't want to talk about weight in front of their child, it goes to all these other just even general pediatrics things where sometimes it's like, oh, we don't want to talk about their behavior in front of them. We don't want to talk about something that's sensitive. But I think, like you said, kids know. and they appreciate being part of the conversation. And I think it's a great way for pediatricians to be able to show parents this is the way we should talk about these things with them. And, that it doesn't, these things that we're discussing, they don't have to be a negative, like we're all here to help. We're all here to do the best for them. And so it was that really kind of hit home. I'm like, yeah, we have those conversations all the time where, people I think are a little hesitant to talk in front of the child, but I think it's all about how you frame what you're saying. And as you both gave some great examples of how to say those things to them. And, it doesn't have to be a weight focus or a what you look like focus, right? But more lifestyle and health in general. So that was perfect. A very specific question here, but something I wanted to touch on. Of course, not all families have access to the same supply of healthy food options, depending on, certain patient populations. Are there any specific recommendations that you can share, either one of you could share, to help families when these barriers exist? I mean, obviously, fresh and healthy options aren't, they're always feels like the most expensive thing. And, when you think about fruits and vegetables at the store, the things that are going to go also bad first, right? Like they're the things that you feel like, most expensive, but also most healthy. Any just tips for sharing with families or, ways to counsel them if that's something that they maybe bring up to their pediatrician?
Absolutely. And I think we screen everyone for that and try to do so in a non-judgmental way, especially right now. A lot of people are struggling with food insecurity that might have not in the past. And I think the thought is like, oh, you have to get organic food for your child, right? Or it's that or nothing, essentially. And because you want to be the best parent you can and you want to give them the best you can. And so we really try to work with families, one, culturally, what are you eating, right? And then how can we make that balanced? And so frequent tips that we have is frozen vegetables are great, right? They're cheaper, they're great, they last longer. So especially if you're working multiple jobs or late and you can't get to the grocery store every week, that's a great thing to do. Canned vegetables, try to get the low sodium ones. Those are also fine. There's nothing wrong with that. And then just making sure like where you shop is the best option. Aldi's is a great option depending on where you are in the country. Maybe that's not offered, but there are different stores that are better about having balanced options at more affordable prices, right?
Great. Yeah.
And then also, school food we know is high in sugars and has been worked on in the past 5 to 10 years and is something that's still changing currently. But there are things that you can get from school that are balanced. And so if your child's offered that fruit or vegetable, or some of them are allowed to bring the apple home if they don't eat it, right? So that's something else we can do. And we also tell families, there's not going to be maybe fresh fruits or vegetables at the local pantry, but maybe there are shampoo or other products that you could use so that you could save some of your resources for fruits and vegetables. And then here in Cincinnati, we're so lucky to have places like La Soup that provides meals for families. And then people in our families in our program, we sign them up for the TANF program to get fruits and vegetables. And so just depending on where you are, working with social work and understanding what's available, because sometimes there are programs available that families just aren't aware of.
That was a great kind of indirect way, like you said, to, check the pantry for other things. Maybe they're not food related, but then you can save so that you do have more money available for
Absolutely.
some of the things that are healthier.
And I think just letting families know that you understand that pantries don't have good options, because it can be really frustrating for families to get information and be like, they're like, I know, I've tried that already. So whenever we share information with families, we try to also share that, hey, I might be telling you something that hasn't worked for your family. And please feel free to share that with me, right?
Sure.
Because you know your family best and what works and what doesn't work. Same with goal creation when you're making lifestyle changes. I tell the child, like, I want you to be in charge of determining what goals you want to do, but your parent or guardian, they have to be in charge of how that's going to work for the rest of the family. And if this goal doesn't work for everybody, maybe that's not the goal we choose, because healthy is healthy for everybody and it shouldn't just be for you.
So thinking back, we've had some wonderful information shared, I think, today for pediatricians. And I've really focused a lot on how we should talk to our patients and families and lifestyle management. At what point would you say a primary care physician should consider, okay, this is beyond me. We need to go ahead and refer for maybe a nutritionist or for someone for an obesity management program? At what point, and I know that's a little bit of a kind of vague question, but are there specific kind of things you can guide us on? At what point do we just say, okay, we need some more help and it's time to refer on?
I wish I had a more clear-cut answer for
It's okay.
you. Honestly, it depends where in the country or what continent you live in, the services
Sure.
that are available to you, whether you're rural or in a city. And also, every pediatrician is going to have their own specialty. Some focus on obesity medicine, others focus on ADHD or other issues. And so I think number one is what can you provide? Both what do you have time? Because I know pediatricians are very busy and you have about 15 minutes to do 30 things. And if you have a dietitian in your program or one that you can refer to, then possibly referring to tertiary weight management is going to be something you do later down the line versus if that's potentially not a skill set or something you don't have time for. And there are programs in your area that will accept children without comorbidities, then I think the earlier the better if there's availability, because the earlier we make these changes while a child is still growing vertically and prepubertally, the easier it is for their body to develop the muscle they need to be able to socially and in terms of sports continue to keep up with their peers, develop a positive mental health. And so for me, there's never too early of a time. But that being said, pediatric weight management programs don't have capacity for every child either. And so this is something that we're trying to provide the skills to the general pediatric population as well. And so I think if each clinic just takes into account what they have access to in terms of a dietitian or local exercise programs, and then what's missing, we are also here at Cincinnati Children's always happy to work with local physicians if these are skills that they want to build on, so that we can work as a community to keep every child healthy.
I think that makes a lot of sense. Like I said, it was a relatively vague question, but it depends, right?
Yeah.
It depends on what area you're in. It depends on how comfortable you feel as a general pediatrician. And then I think sometimes just where the family's at, right?
Absolutely.
And kind of meeting them where they're at and what makes sense for them. If they're extremely motivated, and maybe it's great to do that sooner rather than later, and maybe it's something you ease into if need be. But
Absolutely. And comorbidities as well, right? If you have a
sure.
child with sleep apnea or someone who needs back or spine surgery, or a comorbidity that's really negatively impacting them early in life, right? Let's get them in sooner and be able to decrease their risk of having to live with those things long term.
So, Dr. Ley, I was curious, do you have any other kind of resources to share with us that are maybe more body image related and not necessarily truly a weight management program? Maybe it's a child that's struggling with body image without, needing true weight management concerns, or maybe it's both. Are there kind of other avenues we should be thinking about besides just referral to a weight management program?
Yeah, definitely. So when we think about supporting kids with body image concerns, we know it's pervasive, right? So there's a part of this that is going to be very natural to struggle with. The two things I'd be thinking about are distress and impairment in functioning. So distress being is this resulting in a lot of anxiety, social anxiety? I can't interact with others because I'm having such negative feelings about myself. Is it leading to depression, withdrawal, isolation from activities? Or is it impacting functioning? Am I skipping meals or doing other unhealthy weight control behaviors because of my negative body image? Do I fear gaining weight? Am I not participating in activities I would otherwise participate, like wearing a bathing suit at the pool or joining the cheerleading team because of my body image concerns. And I think in those situations, a referral for a local mental health provider would be very appropriate to either address the body image concern specifically, or it could be a symptom of broader mental health concerns. So for further evaluation.
Absolutely. Thank you. I think that's the, other huge part of this that maybe we don't do as good of a job at as general pediatricians, and some of us probably do, but Dr. Kharofa mentioned you have so many things to do in one visit that it's like, are we focusing more on this versus truly supporting mental health, which is just such a huge thing. So I really appreciate that just kind of expertise and reminder of how important it really is to address as well. Well, I have really enjoyed this conversation. I have learned lots of good tips personally, and hopefully our audience will agree. But, I think this is a difficult subject to talk about. So having both of you here who have such broad knowledge of all of this has been wonderful. So I want to thank both of you for being with us today. And just remind our listeners that we do have CME available at the bottom of the podcast page, questions to answer that were covered. And thank you again for being here.
Thank you so much for having us.
Thank you.